good day, ma'am. I'm Angeline Maulino, and I will be doing the fine motor for upper extremities. So, for the purpose is to examine the proprioception or cerebral function, and then for the assessment, inquire if the client has the history of the pain for the upper extremities, as well as the elevating and aggravating factors such as tingling or numbness, tic or tremors, and paralysis. And the next is provide for client safety or privacy. And then next is um, um, explain to the patient what you're going to do and what is the purpose and how she can cooperate. So for first is I will be inquiring the history of my patient. So ma'am, meron po ba kayong history na namamanhid po yung mga kamay ninyo and nagkakaroon po ng mga tusok-tusok or numbness? Nagkakaroon po? Okay, so there is history for my patient. And then next is for the securing my patient privacy, I will be closing the door. And then next is explain to the patient what you're going to do and how is it necessary, and then how she can cooperate. So good day, ma'am. I'm Angeline Maulino, your student nurse from 8 a.m. to 3 p.m. So the procedure that I'm going to do is I will be assessing your upper extremities, and then the purpose of this is to check if there is any abnormalities on your cerebral function. Is that okay with you, ma'am? So if you have any question, clarification, just feel free to ask me. So we have 5 tests to do. First is the finger to nose, and then altering supination and pronation of the hands on the knees. And then next is finger to nose to the nurse's finger, and then finger to finger, and then finger to thumb. And then, so ma'am, ang gagawin nyo lang po is, first po is, taas nyo po yung kamay ninyo. Dapat po, so, okay na po, po kayo ma'am. So, i-ano nyo po yung kamay ninyo. Dapat po, pantay po sa may balikat. And then, ang gagawin nyo lang po ma'am is, ipupunta nyo po isa yung kamay sa ilong. And then, alternation lang po. Yeah, ganyan lang po. Yeah, yan. Yan. Okay. 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 So, okay na po ma'am. So, as we check my patient, as I assess my patient, so there is no any abnormalities. And then next po is ma'am yung altering supination and pronation on the hands to the knees, on the knees. So, yung ganito lang po yung gagawin ninyo. Ganyan, 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 ganyan. Gawin nyo lang po ma'am kahit kung gano'n nyo kayang kabilis. Sige po. Kung kaya nyo pa po ng mabilis, pwede nyo pong gawin. So as, okay na po ma'am. So as we assess, there is no abnormalities and hindi naman siya nahihirapan while doing the procedure. And then, next is finger to nose. Gawin nyo po finger to nose to the nurse's finger. So, while doing this, we have 45 centimeter away para po sa pag-touch ng patient sa kamay ng nurse. So, di ba, finger to nose and then ganyan. Hawakan niyo po yung ilong ninyo dito po sa akin. Hawakan niya, tapos ilagay niyo po dito sa kamay. Okay? Gawin niyo po ng mas mabilis. Mas mabilis pa po. Mas mabilis pa po. Mas mabilis pa. Okay. Okay na po. So, there is no any, so while assessing this, there is no any abnormalities, and then, hindi siya nahirapan while doing the procedure. And then, next is finger to finger. So, ma'am, taas nyo lang po ulit yung kamay nyo. Dapat po, pantay po ng shoulder. And then, next po is, ipagtugma nyo lang po sa gitna yung kamay nyo. Sige, mas hanggang sa bilis na kaya nyo po. Sige, mas mabilis pa po. Mas mabilis pa po. Okay. And then, for the last test, we have the finger to thumb. So, next po ma'am is gagawin nyo lang po to. Mas mabilis pa po. Mas mabilis pa po. Okay. Sa kabilang kamay naman po. Okay. Mas mabilis pa po. So, okay na po. So, while doing this, all of the procedure, the test, there is no any abnormalities where it is good for my patient, and there is no any as I assessed, there is no any abnormalities on my patient cerebral function. And then, nagawa niya naman po lahat ng test, which is good. And then, wala din po akong napansin na any abnormalities, which is good. And then, next is secure the patient's safety and comfort. And then, document all the findings. And then, for the evaluation is assess the patient movement while doing the procedure. And then, identify the variation. And then, last is report the significant deviation from normal to the physician. So that's all.